Hello, athletes, parents, weekend warriors, and anybody interested in injury prevention. My name is Dr. Michael Parman, and I'm a board-certified sports medicine trained orthopedic surgeon at OSMS.
And I'm Alanna Parman, and I am a personal trainer here in Green Bay.
Today, we're here at Synergy Sports Performance Center to discuss and demonstrate some exercises, stretches, and warm-ups to help prevent knee injuries. What I'll be doing today is I'll be explaining some of the common exercises that we're going to be using, and then Alanna will be demonstrating and also providing some additional key tips on how to properly perform these exercises. One of the most important things to do prior to partaking in any sort of athletic activity or any sort of exercise program is to perform some dynamic warm-ups, which includes 5 to 10 minutes of simply biking on a stationary bike, or even simple as taking a walk on a treadmill for 5 to 10 minutes to get your blood flowing. Following the dynamic warm-up, the next most important thing to do will be to stretch some of the muscles that are extending beyond our knee joint. And we'll be able to do that with 3 simple stretches that will be demonstrated now by Alanna. The first stretch that Alanna is demonstrating is a heel cord stretch. And this stretch is going to stretch out a couple of the muscles in the back of our legs, specifically the gastrocnemius muscle, which does actually cross the knee joint and extends to the back part of her thigh. And so what she's doing is she's pressing up against the wall gently and feeling a stretch along her hamstrings and the gastroc muscle in the back of her leg. And she's gonna hold that for about 10 to 15 seconds at a time. Once she's done that for about 10 to 15 seconds, she's actually gonna then bend her knee, maintaining pressure against the wall. And what that is going to do is that's actually going to isolate her soleus muscle in the lower part of her Achilles as well. It's taking the gastrocnemius muscle out of the equation. So she's stretching several different aspects of her heel cord at the same time. The next stretch that we're going to demonstrate is a standing quadriceps stretch. And the quadriceps muscle extends from the front part of our hip joint and then travels down our leg where it attaches via the quadriceps tendon to our kneecap. And then our kneecap turns into the patella tendon and attaches to the front part of our shin bone. It's responsible for straightening your knee. And so what Alanna is doing is she is pulling her heel up to her glutes and she's feeling a nice stretch along the front part of her thigh.
So if you want to intensify the stretch, you just tilt your pelvis forward a bit. So you see that so this is the regular stance. Tilting it forward deepens that stretch. But if you do feel any pain, of course, back off because that can actually hurt your knee.
The third and final stretch is the seated hamstring stretch. And our hamstrings start at the top of our hip on the back of our pelvis. And then they travel down the back part of our thigh and they extend beyond the knee joint to again attach to our lower leg. And so what this stretch does is you're going to feel a pull as Alanna's bending forward. She's going to feel a pull along the back part of her thigh, and that will stretch out both the tendons around her knee as well as up by her hip joint. We usually recommend doing these for about 10 to 15 seconds at a time, and then doing each stretch about 2 to 3 times before physical activity. The first exercise that we're going to demonstrate is called a half squat, okay? And squats are very important because they actually work all of the muscles that we're going to be talking about later on in this demonstration. So it works your quadriceps, your hamstrings, your glutes, all of the muscles that are important for stabilizing all of the structures and ligaments surrounding your knee. So what Alanna is going to be doing is she's going to demonstrate a half squat for us. So she's going to keep her feet shoulder width apart. She's in a nice comfortable position. She's actually going to put her hands out in front of her so that she keeps her back nice and straight. And she's going to bend down at the knees into a half squat. And what the half squat is she's going into only about 90 degrees of knee flexion. So she's not bending her knee beyond 90 degrees and she's keeping her knees behind her toes. And what that does is that takes some of the stress off of her patellofemoral joint or where her kneecap rubs on her femur to prevent injuries from occurring.
Okay, so a couple of ways to stay safe while performing this exercise is to first of all, make sure that your shoulders are down and back. You're not hunching forward. So as you're going in the movements, you're not going like this. Shoulders are down and back. As you squat down, don't dip into your low back. So don't do this. We don't want to see this curvature in our low back. We want to engage the core. So fully activate those abdominal muscles in order to protect our back as we're doing this movement. And then also for our legs, we want to make sure that our knees are pointed forward, so they're not splaying in or outward. We have that nice parallel position. Snow skis, number 11, that's a good marker to do.
The next exercise that we're going to demonstrate here today is the standing hamstring curl. And again, our hamstrings extend from our pelvis down the back part of our thigh and then beyond the knee. And the hamstrings are really important for push-off strength. They're also very important for stabilizing the knee, specifically stabilizing your ACL. So what Alanna is going to do is she's going to demonstrate that for us, where she's supporting herself on the back of a chair. And then what she's going to do is she's going to flex her knee to where her heel comes back to her glutes. And she's going to feel a nice pull along the back of her hamstring. And if she wants, she can add some light weight to that. Typically, we recommend about 5 or 10 pounds of an ankle weight if you have those available at home. There are also other machines available at the gym if you so choose to increase the amount of weight that you do with this exercise. Next up is a seated leg extension. And what this is going to do is this is going to strengthen our quadricep muscles. One of the more common causes of pain in our knees is from patellofemoral pain syndrome, or the kneecap not tracking perfectly when we're bending and straightening our knee. And so what this does is it strengthens our quadriceps muscles to allow for better tracking of our kneecap in its normal groove to prevent issues with our patellofemoral joint, or the joint in front of our knee. So what Alanna is going to do is she's going to sit down on the chair and she's going to keep her nice posture, and she's simply going to straighten her leg out until it is fully extended, and she's going to hold a nice stretch there. And you can see her quadriceps muscles right here. Every time that she straightens out her knee, those contract and they become nice and strong. Again, if you're at home and you'd like to increase some weight, you can use a 5 to 10 pound ankle weight to improve some resistance. If you have a gym membership or access to a gym equipment, this is a common exercise that you can have available at a gym. Most gyms will have a seated leg extension machine as well if you want to increase some resistance. Next is an exercise to strengthen our hip abductors. And what those do are muscles are responsible for moving our hips and our legs out away from our body. And this is another exercise that's very important for preventing issues with our patellofemoral joint, or preventing excess stress where our kneecap rubs on the femur. So what Alanna is going to do is she's going to be laying in this position here where her bottom leg is bent and her top leg is straight, and simply she's going to raise her leg in the air, and she's going to do that nice and controlled, and she's going to hold that, and she's going to do again 10 repetitions. She's going to feel a pull in the muscles on the outside portion of her hip. And again, what that does is that allows our knee joint, our patellofemoral joint in the front of our knee, to track much more central in the area that it's supposed to.
So as you're doing this movement, it's really important to make sure that your hips stay stacked, so you aren't opening up towards the backside, or you aren't bending forward towards the front. We really want to keep those hips stacked to really strengthen those abductor muscles.
And as we continue to build strength over the course of several weeks, again, what we can do is we can add some weight. Typically a 5 or a 10 pound ankle weight is really all we need. We can pick those up at a local sporting goods store, and we can continue to build up strength in those hip abductor muscles. The last exercise that we're going to demonstrate today is a leg press. And similar to the half squat, this exercise is going to work multiple muscles in our leg to help prevent knee injuries. And not just focus on one muscle. So what Alanna is going to do is she's going to use this resistance band, and she's going to bend her knee towards her chest to about 90 degrees. And then she's going to straighten her leg out, and then bend it back, and then straighten her leg out. And again, similar to the half squat, we want to keep this at about 90 degrees because that's going to put less stress on her patellofemoral joint and also help prevent injuries while strengthening up all of the stabilizing muscles and tendons surrounding her knee.
A couple things to pay attention to when you're doing this exercise. You want your starting point with your knee bent to be at about a 90 degrees. So you want your hip or your knee to be just over your hip. You don't want to create a less than 90-degree angle here, because this can start to put some pressure on your hip, the nerves in your hip, and you'll start to feel some pain in this area, and over time that can create some issues. So we really want to make sure we have a 90-degree angle here. Your knee is bent at a 90-degree angle, and then when you press your leg out, so as you straighten your leg, you're not hyperextending your knee. So this is what you should not do. You should not hyperextend like that. We want to really make the motion nice and smooth, stop right about there to protect our joints.
For these exercises, we typically recommend starting at a lower weight. We recommend doing 10 repetitions with 3 sets at a time. And we usually recommend doing these about 4 to 5 times per week. If you'd like to incorporate weight with ankle weights or resistance bands, that's certainly an okay thing to do as you become more and more comfortable doing these exercises. Many gyms also have equipment available to help increase some of the weight or resistance that you do with these movements. If at any point you do develop some discomfort or pain in any area, whether it be your hip or your knee while performing these exercises, I would recommend that you discontinue these exercises and give your body a chance to rest and recover. Certainly if you find that the pain is getting worse, then calling OSMS or myself to be seen by a physician would be another step that you could take as well. If you have any questions about some of the exercises that we demonstrated today, please feel free to visit our website for any additional information about injury prevention. If you have pain that persists or is getting worse or is not getting any better with the exercises that we demonstrated, please give our office a call or schedule an appointment online. Thanks for watching.